I am Madeline Fitzpatrick. I'm a second-year resident at the University of Tennessee in Nashville. I'm presenting an exceptionally rare protozoan infection in the US. It's a case of neurognathostomiasis. So we had a 49-year-old male. He really had no past medical history. He presented with 1 week of progressive numbness, weakness, and left arm pain that radiated up to his neck. Of note, he was a chef. He'd immigrated from Thailand 5 years previously, and he hadn't had any return travel to Southeast Asia. Initially, his lab work was unremarkable except for an eosinophil count above 2,000. His neurological exam was also initially unremarkable, but on hospital day 3, he developed paraplegia, urinary retention, and sensory deficits below the mid-thoracic level. At that time, he had a lumbar puncture performed that revealed greater than 17,000 white blood cells, of which 75% were eosinophils. Testing was performed for parasitic worms native to the US, and these all returned negative. He got repeat brain MRIs almost every day. He was hospitalized, and on hospital day 5, there was an acute change, and what was thought to be multiple tortuous vessels with surrounding edema within the medulla and the right cerebellum was seen. This can be seen in the picture on the bottom left. So a biopsy of the cerebellum was performed by neurosurgery, and a live gnathostome was extracted. It can be seen here on the bottom right. It was 1.2 centimeters in length, and it was sent off to the CDC. It was confirmed to be a gnathostome, and it was a female, and also was identified to be a young adult. So unfortunately, despite treatment with albendazole and steroids, the patient's neurological status continued to decline. He ended up requiring intubation and mechanical ventilation. Following the brain biopsy, he also had an obstructive hydrocephalus, and EVD drain was placed emergently. And despite this, his neurological exam continued to worsen. He didn't have any gag reflex. His pupils were fixed and dilated. And unfortunately, further care was deemed to be futile, and his family decided to withdraw care at that point. So an autopsy was performed, and no other worms or nematodes, none other were seen during the autopsy. And these first 2 pictures were pathology that was obtained during the autopsy. And figure 1 just shows a hemorrhagic tract in the brain that was noted. And figure 2 is pretty much that same picture, is just magnified and showing the necrosis and the inflammation associated with the tracts that the parasitic worm had made. Gnathostomiasis is endemic to Southeast Asia. It's particularly seen in Thailand and Japan. Humans become infected by eating undercooked meat or drinking water that's been contaminated by its larva. So there's a cutaneous form of gnathostomiasis. It presents with eosinophilia and these migratory cutaneous swellings that are associated with pain, erythema, a lot of itching. These typically begin 3 to 4 weeks after ingestion of the parasite, but it is possible for them to appear months to years later. It is a little bit less common, but the larva can migrate to the CNS, and so these patients will present with sudden onset radicular pain and paresthesias, closely followed by paralysis, which is what was seen, unfortunately, with our patient here. The diagnosis is really made by clinical presentation, exposure history, and the eosinophilia. Serologic tests are available in Thailand and Japan, but they are not available here in the US. So surgical excision, when possible, especially with the cutaneous form, is the treatment of choice. However, the surgical removal is not feasible. Albendazole is the drug of choice here. Once it becomes central nervous system gnathostomiasis, the treatment really is supportive, and it's unclear whether treatment with corticosteroids or albendazole is beneficial for these patients. So even though this is extraordinarily rare case, with the increase of international travel and immigration, especially here in Nashville, we have a large immigrant population. Clinicians just need to be aware of parasitic infections and their potentially devastating consequences. Thank you so much for your time.